Morning, everyone. Welcome to the Scholars Table. I'm Dr. Banda Khalifa, your host. On today's episode, I have the distinct honor of speaking with a global authority in cancer epidemiology and public health leadership. He's a distinguished James McGill professor at McGill University, where he also serves as a director and associate dean of the School of Population and Global Health. He's the editor in chief of the prestigious Journal of National Cancer Institute and the president elect of the International Epidemiological Association. He's one of Canada's leading figures shaping the future of global health education. So, on this episode, we are going to explore his leadership, graduate education, and what the future of public health and global health education looks like beyond the United States. We're going to discuss it through the lens of McGill University and Canadian academia. So thank you so much for joining us, Professor Franco. It's honored to have you.
Well, the honor is all mine. Thank you very much for having me. I appreciate that, Dr. Khalifa.
Awesome.
I'm happy to answer any questions you may have.
Okay, excited to have this conversation. Looking at the circumstances we find ourselves, of my followers, graduate students, health professionals who are looking to sometimes explore the next steps in their academic journey. So we're happy to have you from Canada. At least most of my guests have been from the
Yes,
US. Before we start, can you sort of walk us through? I know you can't talk about everything, but can you walk us through some of the important milestones in your academic journey, some of the experiences that have led you to specialize in a particular field that you're working on right now?
sure. Thank you. I've been around for quite some time. So I'm Brazilian by birth. I'm in Canada for 35 years, but I had a trajectory that took me from Brazil to the United States, back to, and then eventually Canada. So I eventually became a cancer epidemiologist around 1984 when I moved from a career for my training in microbiology. I went to my undergraduate is in Brazil from University of Campinas, and then I went to CDC to be trained at Bureau of Laboratories. My work was in parasitic diseases. Then I moved to the malaria branch at CDC in Atlanta. So from 1980 to 1984, I was privileged to be part of this training program at CDC, which had a cooperative agreement with the University of North Carolina in Chapel Hill. So this allowed me to get my DRPA in Chapel Hill and in health parasitology. As I was completing that training, I always had an interest in immunology, and the opportunity came um, at the end of 1983 to the so-called Ludwig Institute for Cancer Research, which had branches all over the world, and I was given the challenge, the task, with honorable of leading the epidemiology group in at the institute in São Paulo. So back to Brazil then. So after
Okay.
my original Brazil, then to in the US training, and then back to Brazil for this position, which I was also an opportunity to being in being a trained in microbiology. I
Hmm.
I always an interest in biology, as I said. And what convinced me to move to cancer epidemiology was the fact that in Brazil, particularly in many developing countries at the time, low and middle income countries, as we call them now, cervical cancer was a disease of major importance. And I was lured to that because of the possibility. We're talking about 1983, remember? So, end
Yeah.
of 1983, I was thinking about a virus being a possible cause of cervical cancer. This had been discovered by Professor and his colleagues in Heidelberg in Germany. So I was very excited about that, being someone who has an understanding in dealing with infectious disease epidemiology, to be able to tackle this new challenge as an epidemiologist now working on cervical cancer prevention. So that was how I started in Brazil, the head epidemiology unit at the Ludwig Institute for Research. I was in that position for about 5 years, and then opportunity came to come to Canada and continue on the same line of research and I have been here for the last 35 years, having having nearly 40 years of my life devoted to studying HPV infection, human papillomavirus infection, and how it eventually leads to cervical cancer and many other HPV associated cancers, the means to preventing them. I have been involved in my research with HPV vaccination, was part of the initial trials that led to the approval of the bivalent vaccine, and also
Mm-hmm.
screening using
Yes.
molecular tests for HPV, testing for HPV as a superior technology relative to the old PAP cytology used for decades and decades. So it's very exciting to be in this moment in my which I, like many of us, I was instrumental in helping the evidence base that eventually is leading us to this fantastic opportunity of eradicating a cancer. We never thought about this could be perhaps a little too strong, eliminating a cancer, but to make it so rare that eventually is going to be like it has disappeared. It's a fantastic opportunity because cervical cancer is a very serious disease
Mm-hmm.
responsible for so much morbidity and mortality throughout the world, but particularly in low and middle income countries, as you know.
Yes. I mean, it's a whole podcast to talk about the whole issue surrounding cervical cancer vaccines. Because several weeks ago, there was this argument. I'm sure you are aware about the current climate of online on Twitter talking about the fact that you know the isn't effective, neither is it safe. So for the population who are watching this or who may stumble upon this episode, what message you have for them with regards to the HPV, its effectiveness, its safety? This is not the main reason of our podcast, but you having been involved in the earlier development of the vaccine and the trials and everything, I would really love to hear your take on the vaccine.
I'm delighted to do so. I have been involved from the very beginning when from one of the vaccine companies, GSK, was developing the bivalent vaccine, and the whole process began in the mid '90s, mid to late '90s, 1997. It took about 7 or 8 years to complete the phase two trials of the vaccine. A year later, the trials, initial trials uh, for the vaccine by another pharmaceutical company were completed. More or less 1 year apart, the two vaccines, bivalent, one quadrivalent, developed completely independently via different mechanisms of production, but both based on the same principle, so-called ELP particles, and which was a pioneering approach to doing that, and it could be exceptionally efficacious in phase two trials. Eventually, phase three trials had already began. So, 2004, 2005, years in which the initial publications, the papers that were published all in the Lancet, in fact, in the journal Lancet. And this led essentially a validation of the discovery originally by Harold Zurhausen in 1983, many years earlier, and he won the Nobel Prize in 2008, mostly because of the vaccines demonstrated clearly that HPV was a cause of cervical cancer, because what was missing was eliminating HPV from the equation, then observing that once HPV is eliminated, cervical cancer or the precancerous lesions of cervical cancer would not happen. And
Hmm.
with over 90% efficacy. It was unheard of. In fact, when it began, and we're talking statistically about what would be a good expectation for success, and we with figures such as 50%, we'd be very happy with 50% efficacy. Well, we got a big bonus, over 95% efficacious in reducing of these precancerous lesions. And this is, of course, the situation in the that led approval. The vaccine was approved by FDA in 2006, and many other countries followed suit. In Canada, it was approved more or less at the same time, but it was incorporated in our healthcare system here beginning in 2008. And many countries continue to wait Today, we're in 2025. Most countries have already adopted their national programs. They have adopted HPV vaccines. It began as a three-dose vaccine via subsequent research. Now we know that two doses of the vaccine are sufficient to induce protection, to provide protection to young boys and girls who are vaccinated. And now we're moving to one dose vaccine because
Hmm.
these VLP, virus like particle vaccines, are so spectacularly efficacious because they have the quaternary structure that provides long term immunity and very high titers of antibodies that prevent with a single dose without the need for a booster. I'm a member of the one advisory groups for the WHO that's examining whether we should reinforce the need for one dose. There are new studies being published. Now, this, as far as efficacy goes, yes, it's very effective. Now we have finally, as of we have proof that it actually reduces cervical cancer incidence by more than 90% in the countries that were pioneers in adopting it. Now, the question about safety, it's very safe. It's one of the most the ever produced. There's pain in the injection, and that's mostly associated uh, um, the part of the vaccine. The vaccines are now in the second generation. We have multivalent vaccines that increase the proportion of the of HPV that cause cervical cancer. So eventually, we're going to a world in which we will be able to eliminate cancer based on achieving over 90% of coverage of vaccination among girls before the age of 15. Some countries, the rich countries, have moved to a policy of universal vaccination of boys and girls, and that's going to help because it helps to also prevent V-associated cancers that are men, and also because it curbs a transmission in the population. HPV is sexually transmitted, so if you reduce transmission, evidently the diseases that it causes will also decrease as well. Safety is among the safest of the vaccines that are out there. There are concerns about uh, uh, the the vaccine side effects that many countries employ, and it has been verified that there have been reports, for instance, that well, there's associated with HPV. All of these studies have been that they were not studies. In fact, they were just reports, and that there was no link whatsoever. The vaccine, there is the coincidental. Sometimes, when you give the 200 million doses, actually going to 300 million doses already after so many years. uh, Evidently you end up people who have health eventually
Yes.
just position of one event. Oh, the person was vaccinated. After that, a tumor was discovered. It is impossible to have a vaccination today and a tumor happening tomorrow. Cancer is a disease that takes many years, or a similar thing for autoimmune disease. It's just a statistical correlation between those two things happening in the same individual. It happens when you have so many people. The numbers are so big, 400 million, seeing those distributed. And many countries have already practically vaccinated all young people in their population. It's a very safe vaccine relative to the vaccines of the past, which were concentrated in number of. This is a very well designed vaccine, and it's very.
Thank you so much for those reassuring. And I think that's also one of the main reasons why I feel this podcast is crucial because we need a calm. We all know doing an amazing job behind the scenes, but it's also important for people to hear from the to gain that have in public health back. I want us to look at McGill University in general. And I know like a lot of people that are thinking about graduate school, especially from Africa, Asia, and even the Caribbeans, most of the time they are looking at North American universities, especially the US and Canada. And I know McGill is one of the top programs because I've applied there twice. So, in your current role as a director and associate dean, the School of Global Health, Population and Global Health. What are some of the key roles that you're playing, and what strategic directions are you setting for the school's future?
Thank you for the question. It is a great opportunity. It's a great school. It's McGill is it's just completed 204 years of existence. It's one of the most well placed, well rated universities in the world, as you said, and likewise here in Canada. And we do attract 30% of our student base international. So we do attract a lot of international students, and many of them from low and middle income countries. We do have a tradition here with a cosmopolitan fabric of teaching and educating and training the new leaders of tomorrow. The School of Population and Global Health at McGill is relatively new, was conceived back in the 2000s, eventually became on paper and of the school system here officially in 2019. So we're relatively new. We're about the youngest, not the youngest, but one of the youngest units within the health sciences complex here at McGill University. So I was given the privilege to be given the interim director role and associate dean role for the school, which I have been doing for a few months now. I stepped down from a position. I was chair of the Department of Oncology in the Faculty of Medicine for 13 years. After I stepped down from that position, I was asked to be in my current position and set the directions for the school. We have three very strong departments, one of which has been around for 60 years, the Department of Epidemiology, Statistics, and Occupational Health. Its existence precedes, in fact, establishment of the school because it used to be part of the Faculty of Medicine and part of the School of Population and Global Health. And to that department, Epidemiology, Biostatistics, and Occupational Health, we call EBOH for short. We added, the community decided to bring together the talents and the skills and the assets on equity, lots of research on
Hmm.
equity, ethics, policy making, and they're all brought together. These are faculty members that were in different departments, and they were brought together to coalesce into the department of, we call DEEP, Department of Equity, Ethics, and Policy. And
Okay.
we had a very successful global health program, and this program eventually became the amalgamated to become the Department of Global and Public Health. We have great leaders in all three departments. We have Dr. José Dupuy, the director of chair of the Department of EBOH, Epidemiology, Biostatistics, Occupational Health, Dr. Amélie Quesnel-Vallée for the DEEP, Equity, Ethics, and Policy, and Dr. Madhu Karpai as the director and the chair of the Department of Global and Public Health. In addition to those three structures, the classical departmental departments within a school, which is the typical governance, we also have cross-cutting activities. We have a center for climate change and health, which unites faculty members from all of these departments that I mentioned, and we have a new laboratory on preparedness and response. So these are all fantastic opportunities for growth. We have the teaching programs in addition to the VOH program, which has existed for 60 years. The other departments are launching graduate programs in their specific disciplines, and they're currently about to be approved. They have been approved, I should say, by the university, and they will be launched this fall. In fact, we're going to get some new exciting training programs, graduate training programs, in the fall of this year. So the opportunity here for growth is great. So I recommend for those of you, particularly who would like to have an alternative to going to the US to get your
Hmm.
higher education, your advanced education in public health, in global health, McGill is the place to go. We do have, I know that there are challenges these days to get student visas for the US. It's easier in Canada. We do have a little bit of challenges on our side, a little bit. So I don't want to make some of the predicament that you folks are going through in the US,
Yes.
but why shouldn't I, right?
That is very true. That's exactly one of the issues I wanted to raise with you because I've Professor Mabduka Pai. It's also we are connected on LinkedIn, so we chat from time to time, and we think that Canada has an opportunity to actually step up. in these difficult times to take a baton and lead in terms of global health education or public health education. So, to that end, what do you think makes the McGill program attractive, or what differentiates the McGill's graduate programs from other programs?
Our programs are very pragmatic. On the epidemiology and biostatistics training, we have some great people who are trained here that are fantastic. I always tell my students in epidemiology that I don't want to mean anything bad about University of North Carolina because I got my degree there. I really enjoyed, and it's a great school of public health. But I look at what my students go through at McGill. I'm really at the end, just a wonderful thing to see them beginning, much they know in the beginning, which is little, but they're so eager to learn. And 4 or 5 years later, they are just so competent. And I know way more than in terms of methods in epidemiology by the time they graduate. In fact, just today, one of my students defended her thesis, and she has an epidemiology degree, a PhD in epidemiology. Anything is in relation to programs that are more eclectic. As you know, universal healthcare system, unlike the United States. So we do have characteristics of public health that are truly public. They're truly global definitions. So principles of ethics and the elimination of disparities. They are just built how we public health here because of the nature of our healthcare system, which is the same as in many European countries, unlike the US, which is a different type of healthcare system,
Hmm.
it's healthcare, some of which it mimics the we have in a system such as ours here in Canada of giving equal treatment to everyone, to give the most of the benefit for the vast majority of the population. So these are inherent characteristics of public health. We talk about public health, automatically we talk about accuracy, about dispensing the benefit to most people, which is a natural here. So it's part of our fabric. It's part of how we practice. So this is the pragmatism that I mentioned. People have the opportunity to actually be in directly from the actual frontier of public health and learn from people who are academically among the best professors. We're not as big as Johns Hopkins, for instance, which has an actual public health with a tremendous history of contributions and has also off such as GPIGO and so many NGOs that spun off Hopkins. So we do have somewhat of a similar situation here with activities. We have um, work we do, collaboration with in Kenya, in sub-Saharan Africa, Latin America. Lots of our faculty members have projects all over the world. So it creates a great opportunity for us to be exposed to research ongoing and to learn from the best and eventually learn how to publish, to communicate research in an environment that's bilingual. French and English here dominate equally here in Montreal. So it's
Hmm.
a great opportunity for people also for the francophone countries in Africa. We're a great opportunity here. Students are free to in English or French to write their exams in both languages. So it's truly
Okay,
a
yeah, that's
Wellington
interesting.
environment here for the interest in coming here. So please do come. Send them here.
Okay, so I know, like, before even make an attempt to there are requirements that they have to meet when applying. So I know it's the usual maybe recommendation letters. I know when I was applying, I needed a recommendation letter. I needed a personal statement, a resume, and I needed to fill out some of the application portal. But the reviewing process, or let's say the when you're reviewing applications, what specific qualities or experiences do you feel usually distinguishes a strong candidate from a candidate?
Well, in addition to academic achievement, a good track record in undergraduate training. Look for people who are willing to take risks and want them to demonstrate why they want to be following a public health career. So we want people motivated, and motivation. comes from within. So people who have the maturity of understanding what is a public health career. Much of that is on being articulate, being someone who communicates, persuades well. So usually, from the application standpoint, we want to see a statement of career aspirations, and of course, testimonials from people who know the student. And at the end, everything we look at the package and we admit the top students. McGill is very selective, but it does also give so much value to the education that someone brings to us. And we appreciate also the experience that people bring to McGill as well. Look at campus right across the window from my office here. It's just wonderful. Summer started, of course, everybody's outside, so people are
Yeah.
enjoying themselves. Oh, I should not be talking about summer because then I should be talking about winter, right? Would you have a question for me about winter?
Really, I like Montreal is colder, right? Especially during the winters, compared to maybe British Columbia or maybe Vancouver specifically.
Yes, indeed. But listen, a student here is not going to suffer more than if a student went to Harvard in Boston or to Yale.
Yes.
We're about general northeastern North American climate, and I have a mountain. Where else would you have a mountain in the middle of the city? So McGill, I wish I could show you the picture the window that I'm looking right now. Beautiful campus, Victorian architecture, and the mountain in the middle. And then in the winter, you could go country skiing, which is just outside campus. So it is a great opportunity for winter sports, and you can be cozy as well because a very efficient snow removal in the city here. So we're used to, and so we're probably Boston would probably close all schools. We would keep open because we're not really.
Okay, that's. I mean, slightly about the um requirement, but one other important thing, and one aspect that usually international students feel that the US is more attractive is the availability of funding. Even if it's not something to cover everything, for example, Hopkins, um, almost students get something small to start with. So when it comes to McGill, what are some of the funding opportunities available for prospective students, especially international students?
We do have funding packages. What do we offer? We make an offer to a student, the graduate students. Eventually, there is an offer. That's a combination of sources. It's a combination of various accounts that we have people who donate to McGill to create endowed scholarships. It's a combination also of the supervisor's funding. So eventually, every graduate that comes to McGill has already a funding package, which is commensurate to life in Montreal. Let me remind you, it's way more expensive in Baltimore or in Michigan, for that matter, than it is in Montreal. Montreal is one of the cheapest places in North America to live. Housing is cheap. Living is much lower than some of the major metropolis in North America. So, it perhaps on a dollar per dollar basis, not as high as a fellowship at Hopkins, but the student would be spending less for housing, would be spending less for eating and meals and transportation as well, in addition to having access to a universal health care. Free.
Yeah, I mean that's really attractive. So I know in the beginning you mentioned that McGill it's to a lot of international students. I think you mentioned like 30%. Do you have idea um where like these usually apply from? Is it like mainly from Africa, from Asia, or from where? Do you have any idea about that?
Yes, in fact, the last time I looked at the statistics, it was over 80 countries were represented in the international students. Mind you, interestingly enough, we have lots of American students. Why? Because it's much cheaper to get here at McGill than it is to go to the US. Tuition is here. and McGill it's a chartered university. We do, though we're private, we do receive subsidies from the Quebec, and so it's much cheaper. Tuitions and fees are much lower here than they would be in a state university in the plus cost of living. So this makes it very attractive to American students, particularly those who have an aspiration to an Ivy League education. You know, the Ivy McGill, they part of this Ivy League of schools, and we have a joke here that Harvard is the McGill of the South. So of course, I mean, some people McGill is the Harvard of the North, but we kind of use the in just for fun. So it is a tremendous education, and I see we have Nobel Prize winners, we have people well
Hmm.
placed, we have people well placed in academia, in politics, and so it has a tradition of training the best and the brightest, and having adding value to their education, their pre-existing, and also the fact that we've been around for so long, and we have McGill alumni all world. And so when I travel often enough, but people backpack with the McGill logo and come to me, I studied at McGill, or, I best years of my life when I was a student there. So, it's more than education. It's an opportunity to be in a place we don't have immense resources like the American universities have. We punch way above our weight with respect to the resources we have. So students here, they learn to make the best out of very little. That in itself is a great quality to be successful in a public health career, right?
That's true. Thank you. Thank you so much for highlighting the special of McGill. Yeah, and that's I nearly for the fact that I think my wife had already started her graduate school at Hopkins, so I had to stay back at Hopkins. But I think international students, I know a couple of people currently doing their PhD there, and the experience has been amazing so far. I want us to talk about something also very important, especially in these times, with regards to global health in general, and let's say EPI. As an incoming president of the International Epidemiological Association, what are some of your strategic priorities for advancing the field of EPI?
Yes, thanks for this question. Yes, I've been privileged with this new role as I'm currently president-elect, which I was elected in 2024, and 27 when the new World Congress of Epidemiology will take place in Colombia. I'll become officially the president at that point, and then 3 years later, I'll become past president. So it's a long role that I will have over 9 years to assist a very strong professional society such as the IEA. The IEA had an illustrious history of forging the principles and the framework of how epidemiology needs to evolve to be a relevant discipline of public health. So it is in that same spirit that I want to have my mandate to strengthen, particularly to strengthen epidemiology training and provide skill sets all over the world to eliminate inequity in training, which has existed. We just talked about that. In fact,
Yes.
we need to remove this colonialistic attitude that we have in high income countries of trying to teach others on how to do things. There's a lot of talent, and I see a lot of talent in all over the world. As I mentioned to you, I'm from Brazil. I'm Latin American, and I go often back to Latin America. I travel all over the world, and I see great science, great epidemiologists. But a lot of that eventually does not reach the mainstream because of communication barriers
Yeah.
and other problems that I'm happy to talk about. So I want to eliminate all of that. I want to be able to have the society, the IEA. We publish an international journal of epidemiology published by the IEA. I want to be able to bring more of the same credibility that epidemiology practiced in high-income countries enjoys, to be able to bring to all countries without that colonialistic attitude that we have had. To learn practices also in training, the challenges that one would have in Kenya or in Uganda to train an epidemiologist without the resources that are needed, with the examples, or so all of these things would be better done in a more communal sort of approach to doing that. And by
Okay.
definition, epidemiology is an instrument, right? We're a toolbox to solve public health problems. We need to make them universally available. The profession has increased in terms of new tools. We're much beyond the days when we had case control studies, cohort studies to tackle, understand etiology of disease. Now we move beyond that. We're doing implementation research. We're doing complex quasi experimental approaches to understanding things without even running clinical trials or randomized control trials. So epidemiology has become a very eclectic toolbox, and we need to apply that in to make that in practice, to make this a more useful to impact on public health and address disparities and creative ways of giving policymakers the ways to control disease and address inequities that exist out there.
And I know you've also have an extensive experience mentoring graduate students and postdoctoral researchers, upcoming scientists. What are some of the core advice that you consistently share with them to help them become better scientists or better professionals?
Thanks for this question. In fact, I have had people joke with me that I stopped in number 100. I'm approaching retirement, so I'm no longer recruiting graduate students. So just today, this morning, in fact, I graduated my student 99. So
Oh,
I wasn't able to get to 100 because I cannot, given my retirement, I cannot recruit someone now because a new graduate student, if it is a master's student, it's 2.5 years. As a PhD student, could be 4.5, 5 years. So I don't have the luxury of that commitment because my decision to. In any case, I digress. But I, yes, I have, and in fact, I owe much of what I have, what I am today, to the to the work with so many brilliant trainees over the years. There was a time when they were all just a little older than they were, and now I'm they're all young and they could be my grandchildren. And it just and that's another advantage of being at McGill because we attract wonderful students, really
mhm.
bright students. So you asked me what is my teaching. Now, over the years, I learned four things that work well with me and work well with the students that I have had who have gone quickly to very successful careers. And four things. And the first the you need is to be good and love what you do. So that goes without saying because if you get a graduate student, that means that the very fact that the student came to you and was selected via a very selective process, it already shows the person is good and has talent, and so it is already have that trait. Second one, the second one, persistence. You it's not being good, but you need to be persistent and insist because there will be setbacks. Grants, projects that will be written will not be accepted, will not be funded. Papers that you write to a journal and eventually get rejected. So you need to have thick skin and understand that if you did something good, eventually you need to insist and eventually compete for that you eventually succeed. So being good, being talented, and then also persisting are two important qualities. But with those alone, you will not go too far without number three. So the third element for success, ingredient for success, is to be in the right place at the right time. And these are so-called crossroads. You get to a road and you took left or you took right. Eventually, those are opportunities. Someone makes you an offer, a job opportunity, or a course you wanted to take or not, and a skill that you could learn or not, and eventually versus another skill. So there are all sorts of decision nodes in your trajectory as a student, as a professional, that eventually take the right one eventually will propel you to go forward. You never know whether it was the right one or not because we don't have the counterfactual of taking the road in which you didn't take. You only
Mm-hmm.
know the one you took. So, but that there's an element of chance there. But if you do not right place at the right time and you simply ignore and let it go, it fails. So number
Mm-hmm.
four is also very important. You need to know it. You need to perceive that you're in the right point at the right moment at the right time and take advantage of that, such as an offer to get a job or an offer to go for a postdoc, an offer to eventually learn a new course or to go to a conference versus saving the money of not going to the conference versus, oh, I don't go because eventually I want to be close to my family in Montreal and do not want to go to NIH or to Hopkins. So risk taking is part of success. And a lot of that risk taking sometimes becomes very complex because you are no longer an individual. You're part of a family. You may have a spouse. You may have many graduate students already have a family or a postdoctoral trainee for that matter. So those are the four ingredients for success. And this is true in science as it is true perhaps in any professional so you need to be good. You need to persist. You need to be in the right place at the right time, and you need to know it that you're doing the right.
Awesome, awesome. I think these are crafted or take home message for young professionals that would resonate with a lot of people. Um, and I that there are also certain elements, maybe interest of maybe interest for viewers when it comes to, for example, publishing and academia in general. And I got editor in chief of the Journal of the National Cancer Institute. That's um, what principles, yes, have guided your approach to ensure that um, science or research is and influence the broader scientific community.
To my point, to this my career, being a scientist, right? And a scientist eventually needs to communicate, and we are in the world of publish or perish, which unfortunately, is the determines how we go for careers. I have success with that. I have published extensively as an author. I have also reviewed and mentored others in the fact that I speak for being Brazilian and Portuguese and also my work let speak Spanish and being in Montreal, English and French. I've seen how difficult it is for those in non English, non Anglophone countries. They have a major challenge in communicating science. So all of that, plus the fact that I had my own experiences as knowing what works and what does not work in communicating science, led me naturally to being devoted to scholarly publishing. I was the editor in chief for 10 years for Preventive Medicine, a public health journal published by Elsevier, and I stepped down in 2022 to become the editor in chief of the Journal of the National Cancer Institute, which whose contents is closer to my research. Between the previous journal and the present journal that I'm editing now, it has been a great opportunity to oversee publication trajectories, to be a gatekeeper, to help people eventually to understand the value of peer review and how peer review, when properly taken into account, can truly improve the quality of publications. So it's an interesting moment we are, and the advice I would like to give to early career public health practitioners and students and scientists is to understand the ecosystem of academic publishing. Medical journals, health journals, we're currently in a state of flux. Some 25 years ago, in the turn of the century, we moved from a and what you published is essentially gone to journals that were well established, and they would sell themselves to universities, libraries, and eventually that was the final product. So the essentially the reader was not paying for the product, and authors did not pay for to submit papers for publication. About 25 years ago, the so-called open access
Mm-hmm.
model to eliminate the disparities in access to science. And this led to a complete revolution in the way journals, eventually, the ecosystem of journals and their life cycle eventually produces. So this has led to some unintended consequences, which have been challenging for to understand, to navigate the process of publishing. But the essential elements continue to be there. Beauty of what brought us to science, to public, is the discovery, the yearning to be able to discover things that are going to improve health, to discover causes of diseases, to discover new vaccines, to develop new, to eliminate inequities. So those are the things that brought us to the world of science, and we need to communicate these findings via scientific publications, and which eventually makes us successful in a career. It's important also in that process is that there has been lately, and you mentioned a minute ago, vaccine hesitancy and all
Hmm.
of those things happening these days. Much of that because of papers that have been discredited, retracted, scientists who are rogue and falsified data. And there's more enormous visibility in what we do as scientists today than we had in the past. Just as a reminder, 1997. 1997 was when the whole National Library of Medicine was put in the internet as PubMed. PubMed, de facto standard in how we practice science in 1997. Before 1997, only scientists read the work of scientists. After
Hmm.
1997, any any member of the public with an internet connection can read an abstract of a paper and eventually read the paper and see what scientists do. So our life as medical scientists, public health is under most scrutiny right now. It has never been under so much scrutiny as there is now. Combine that with the long of anti-vaccine activism, and now compounded by the politics that are affecting all this and questioning efficacy of the safety and all of that. So you're back to that world, and we need to restore dignity. We need to restore seriousness to the world of publishing. So what I'm very much afraid is that some people get a little too uh, taken by the so-called publish or perish. We are in a world of meritocracy. So in science, it's the best ideas go forward. It's the market of ideas to be funded to do research or to have your paper published in a reputable journal. So we're always competing. We're to do our research. We're competing for journal space or to presentations in conferences, prestigious. So that element of competition always exists. But in someone who's not as well prepared in terms of structure, mental structure, and ethical structure, that could be bad. And someone could take shortcuts and eventually do the wrong thing, and eventually could do a paper that would be retracted or and for all of us, because as
Yeah.
scientists, the public is looking at what we do. So, as a curator of a journal, as editor of a journal, which has existed for 9 decades, such as JNCI, it is my responsibility to instill that sense of nobility of and same thing that brought us to do science should continue throughout our careers. So we should be good peer reviewers. So that's how we judge science. So the same way that we would like to have our paper being properly processed by a journal, we want to give back by being good reviewers, providing constructive criticisms. This is the ethos of science, and we need to protect that to avoid assault to an institution such as science, which has existed the way we practice for 350 years. We just don't want to lose that because that's how we make progress. Diseases are cured, new medicines are produced and discovered, new vaccines, and all strategies that we want to do. We need credibility to be able to proceed with it, and being a good citizen of the scientific community is paramount.
Wow, that's very. And for most academic, how should adopt some of these elements in their training of scientists, especially you've clearly elaborated that the landscape of global health or public health is evolving. So how can institutions proactively make sure that future student is well equipped?
So we want ambitious people, right? We want people who are ambitious, long-term goals, and all of that. And being ambitious comes sometimes with taking risks. So for someone who's brilliant and so eager to proceed and publish and do all of that, we need to teach ethics. So it's a very important aspect of teaching early career scientists and the people entering academia to teach them ethics, to understand the importance of being serious and having integrity in research, to show them examples of mistakes are done. Sometimes it may not be lack of integrity by the individual. It could be a lack of integrity by a co-author in a paper, for instance, or a collaborator in a study. So it's important to have that sense of team spirit. So the collective responsibility for the scientific finding is not of one individual responding to all of the others. Everyone has a portion of that. But every one of them needs to be trained on the ethics, understanding integrity in research, the beautiful values that brought us here. Let's remember one thing: society pays our salaries to do research, to discover things, to improve life for society in general. When you submit a paper for publication, the journal doesn't ask whether you have a PhD diploma or not. They believe in the intrinsic value of what's written in that paper. So it is of trust. It's a system of honor. So we need to be faithful to those same principles. Some of the most beautiful discoveries in this were discoveries of new plant species or animal species, and all of those sometimes are done by amateur botanists and zoologists, people who just enjoy documenting things in life, and these people don't have PhD diplomas. They're just they made in understanding taxonomy of plants and things. Same for astronomy. Many celestial bodies have been discovered by backyard astronomers, people who do not have PhDs. So it's honor. It's a system of honor. It's the quality of the science that's produced that's eventually has to truth that goes forward. So in our journals, we look at true. I mean, do we validity is paramount. If people take shortcuts on validity, or they fabricate data to marshal their own beliefs about something, so they become famous, be cited, etc., then that's when the system starts breaking down. How to avoid that? We need to teach them at a young age ethics and the privilege that we all have as scientists, and we're given by society that privilege to discover things. And with that privilege comes the duty of being serious and to.
Wow, wow. Thank you so much. This has been an insightful conversation, and we've tackled everything from graduate school, academia to global health to cancer, leadership. Thank you so much for giving us some of your precious time to educate and this new development. Also open your doors for new applicants, prospective applicants who are looking to advance their in public health and global health. I'm very that this season may be one of the years that we see a lot of applicants applying to McGill University. So it's good to know that all welcome to apply. So thank you so much for your time. Before we add maybe your last words to our written, do you want to leave with them?
Well, thank you very much for the opportunity, which is a great privilege. Thank you. I greatly appreciate that. I wish you all the best with your podcast. Is a career going into public health, and so I encourage all your viewers and your listeners to consider that. It's just a great opportunity to do good to humanity and to good to the planet. Mind much health. These are all things that are happening in our horizon. So within a few years, we're going to have major challenges, the use of entry of artificial intelligence in everything we do.
Hmm.
So new tools and new ways of doing things. So thank you very much for being here with you today and providing a little bit of a piece of my mind in all of these items.
Yeah, thank you so much. I really enjoy the conversation. I'm sure our viewers would also enjoy it. So thank you so much. Enjoy the rest of the week.
All the best.